Good evening, dear patients. This is my great pleasure to spend another hour of this evening together with you. And I am very grateful for International Fertility Group for inviting me to talk to you regarding very interesting and very actual topic for today. This is IVF treatment during COVID-19. Should I get vaccinated before and during the program? This is probably the most frequently asked questions right now from all the patients we are getting all over the globe who are willing to start their fertility journey. My name is Dr. Uliana Dorofeyeva. I am an IVF specialist. I am an expert in IVF since 2008. And I'm practicing in Ukraine, the country where many strategies for IVF treatment are implemented and successfully used for many years already. Since the information from global providers and also World Health Organizations, total number of patients who are experiencing infertility, they are 90 million all over the globe. These patients are looking for their IVF treatment in different locations in different countries. 10 to 15% of those patients will need an oocyte donation as their medical indications for IVF treatment after trying many attempts or fusing own oocytes, and 2 to 3% of all these numbers would request surrogacy. As you all know, many different regulations are valid all over the globe. And in many clinics, in many countries, some treatments are not allowed or very limited. And before the COVID, reproductive tourism was the most requested after the cancer treatment or surgery for like plastic surgeries and stomatology, dentist care. So medical tourism influences and facts were because patients were looking for treatments and medications which are not approved or available in their home country. As for many countries, oocyte donation and surrogacy are forbidden. Patients were looking for reducing costs of cross-border medical treatment, looking for higher quality or the same quality of care and services as they could receive in their home country. And it was additionally great if medical treatment could be combined with attractive destinations. However, all this was before the COVID. And you probably also experienced the fact that during COVID, you've been recommended to stop or postpone your treatment because we were not sure of how COVID will influence our lives, our health, our fertility options and treatment options, and how this risk for the future babies. Right now, we know, and we will talk a lot about all these frequently asked questions which patients are asking regarding COVID influence, COVID vaccination, and how and when you should plan your treatment. However, right now, patients, they cannot stay aside and not being able to receive IVF treatment. So this is very recent information from the open source of egg donation trends worldwide, showing very recent statistics regarding all those inquiries which were gathered on the website of egg donation threads abroad. And it is a data since November 2020 until the end of first quarter 2021. So very recent data, we may call this data during the COVID or after COVID. And as you may see, Ukraine, the country where we are offering our medical services, is already on a place number 2. This is how often patients are looking for the options to be treated in Ukraine. And this is how often we are contacted. All our medical team and our coordinators are contacted for these or others IVF treatments and technologies which we are successfully performing in Ukraine. So goals of reproduction which we provide and which are our main aims is to achieve pregnancy as soon as possible. In different time and in different ages, patients are contacting their fertility specialists in order to receive their IVF treatment. For some patients, this is up to 35 and which is the most beautiful time for IVF treatment, which is connected with the best success rates and the easy achievements of the pregnancy. Some patients are over 35, some are over 40. However, all of those, if they decided already to get their fertility treatment, we would do everything possible in order to achieve that pregnancy as soon as possible. Our aim is to maximize success rate for the first initial cycle of each patient. And for many patients, this is true, that they are coming to our facility and to our team after they've had several unsuccessful treatments, after that they tried some experience in some different locations in different clinics. So we are not the first line fertility choice for most of the patients. However, by offering the complex solution and analyzing their previous medical history and using different approaches for IVF treatment, we still are maximizing the success and getting to the result as soon as possible. Our aim is to reduce multiple pregnancy and guarantee safety in IVF, and also help as many patients as possible, as we mentioned, by reducing the costs in comparison to the costs in their home country, understanding the low limits and offering those options which are legally performed in Ukraine, and using the most effective and sometimes even unique techniques. So once we are talking about these frequently asked questions which are connected to the COVID vaccination, so one of the most common is, should people of reproductive age receive a COVID vaccine? And the answer is absolutely yes. People of reproductive age are advised to have their vaccination prior to planning their IVF treatment, independently if they are willing to have it done immediately or if they are looking for becoming parents in the few years' time. Another very frequently asked question is, can any of the COVID vaccines affect fertility? And the answer is no. There is absolutely no evidence and no theoretical reason why any of the vaccines can affect the fertility of men or women. Can I have a COVID vaccine done during my fertility treatment or not? And the answer is yes. You may wish to consider the timing of having a COVID vaccine during your fertility treatment, taking into account that some people may have slight side effects after the vaccination done, and usually this is during 1 or 2 days after the proper vaccination. So you may plan not to have your egg collection or embryo transfer during this day. So any of these symptoms, such as slight fever or some feeling tired, might be attributed correctly to the vaccination and not to the treatment procedure. Your medical team will be able to advise you the best time for your vaccination in your specific situation. Should I delay my fertility treatment until after I have had the COVID-19 vaccine? The only reason to consider delaying fertility treatment until after you have been vaccinated would be if you want to be protected against COVID before you were pregnant. However, you need to consider the fact, if you are less than 37 years old, unlikely that your postponing of your treatment would lead to the decreasing of your potential of getting pregnant. However, if you are over 37 years old or you are over 40, we would not recommend really to delay your IVF treatment in order to complete your vaccination. Another question very frequently asked is, how soon after having a COVID vaccine can I start my fertility treatment? And the answer is absolutely immediately. You do not need to delay any of your fertility treatment unless you wish to have your second dose done before the pregnancy, but this is what we just discussed before. A question, if I'm donating my eggs or sperm for the use of others, can I still have a COVID vaccine? And do you perform vaccination for all of your donors? And the answer is yes. COVID vaccine do not contain any virus, so it cannot be passed through receiving the vaccine to the recipient. However, the international institutions such as IGPA have recommended to allow at least 7 days from the most recent vaccination prior to donating egg or sperm, just because of the fact of having these side effects. I have had recurrent miscarriages and I'm now trying to get pregnant again. Should I postpone having a vaccine during this period? No, there is no reason to postpone having your vaccine, as it not affect your risk of having a miscarriage. So these were the most commonly asked questions. And if you would like just to make a conclusion, you don't need to think about delaying your treatment, which will be connected to your vaccination. You may plan your vaccination during the process of IVF treatment and not to do one prior to another. If we are talking about, let's go briefly for the processes and treatments which may be offered by International Fertility Group. So if you've been checked by your IVF specialist, probably you know that the success rate depends on the oocyte quality. And the oocyte quality is very much depending on the age of the woman. So we have a line of your age being 35 years old, after which the decrease in the success rate and the quality of your biological material is getting really down. However, there is an alternative, and this alternative is oocyte donation. And as you may see on the graph, in any age, when you are treated with oocyte donation techniques, your success rate for clinical pregnancy is very high, and it is over 50, and in our heads, even 60% per cycle. If we are talking about very important things which you need to consider by using the oocyte donation, so you need to get as much information as possible about your donor, including personal profile, medical information, genetic information which is available, full and extended check-up performed for the donor, like for infection tests, hormonal profile, genetic tests, psychological evaluation, and others. As well as profiles, they include usually adult and the childhood photo of a donor, so you may select how your baby will look like, including the phenotypical characteristics of the donor. For a single woman, very often, there is a need to select a sperm donor or even an embryo donation. So this is also something what we may offer by our team of International Fertility Group. But also you need to know, and we are going to perform more webinars discussing specifically only this question, that right now, due to the scientific developments, oocyte donation has an alternative. And this alternative is connected to the mitochondrial degeneration, which caused the fact that quality of the embryos and success rate for the patients in their adult maternal age are getting lower. However, each couple have a social and genetic right to carry their own genes during the pregnancy, if this is possible. And egg donation is always is easy alternative from the perspective of the clinician. However, it's still big psychological and ethical question for each of the patients. So age-related changes in oocyte mitochondria are the fact that number of mitochondria is going down, and also their quality is going down, meaning they are producing less energy. And mitochondria are the battery of the cell. So by aging of our oocytes and the mitochondrial dysfunction, we have lower IVF success rates, lower fertilization, and higher aneuploidy rates for our embryos. So those alternatives are mitochondrial donation, and you can see a graph how this program works. So we are getting an oocyte from a donor, healthy and well-screened donor, which is selected by you as a patient, and you as a couple are providing also your biological material. We are getting patient egg, and we are taking the nucleus out of the cytoplasm of your egg, and we also take out the nucleus of the donor oocyte, and we put your nucleus carrying the genetic information into the cytoplasma, including healthy and young mitochondria, into the donor oocyte. After changing this nucleus, we are performing fertilization, and the further process is as general process of embryo development. By having healthy and active mitochondria, those embryos are developing faster, they are getting high blastulation rate and high potential for implantation. Plutoprenuclear transfer is technically a little bit different, however, it's very similar in terms of the final result. So we collect donor oocytes, also your oocytes. We perform fertilization of both categories of the oocytes for donor and you. We are getting zygotes, and on a stage of zygotes, we are exchanging pronucleus, which are already fertilized between donor oocyte and your oocyte. And those embryo with pronucleus, which are coming from your oocyte, your husband's sperm, including donor's mitochondria inside of the cell of the oocyte, are developing into the further blastocyst. So advantages of both transfers are that there is no risk of the fertilization for the pronuclear transfer, because the exchange of the pronucleus are done between the zygotes. There is much better blastocyst outcome. Also, these procedures are giving the possibilities for families affected by serious mitochondrial diseases a chance of having healthy children. And also for those patients who may still produce their own oocytes, however, they never result into blastocyst or healthy blastocyst, give a chance to have your biological material within your embryo and carry this pregnancy for the future. Techniques and mechanical micromanipulation requesting experience and special cultivation method during the manipulation, and this is which we provide successfully in Ukraine. Also, very important are the factors of implantation. As well, we will dedicate another webinar to discuss this more deeply. However, as we said that our aim is to maximize the chances for initial treatment to get into the pregnancy, we are taking care not only about the quality of embryos and just the thickness of your endometrium, however, we are checking individual window of implantation of each patient, which is quite common. However, it's done very rarely in the different locations in the world. We perform immune treatment for the patients. We have our IVIG and protocol for treating and covering all the risks dedicated to the immune infertility. We are checking thyroid function and different others, all these factors which are playing the great role into the successful implantation. As well, surrogacy in Ukraine. Ukraine is considered to be one of the recognized centers of surrogacy in the world. There is legal protection of parents' right of the intended parents. Considerable cost and quality balance and comfortable location make Ukraine an attractive destination for intended parents for their way to making their dream about full family come true. So this is briefly everything I wanted to share with you about Ukraine and the options of international fertility group offering for you as a future parent. And we would like to be your team toward to your dream. So I will be happy to answer your questions right now. And thank you for joining us tonight. So I got a question and the question is, should I stay in the quarantine coming from Europe? You should not be quarantined if you perform your vaccination, if you have your vaccination completed, or if you have your PCR test done. So you can easily visit the clinic, plan meeting with your doctor and your clinical staff. You only need to have your insurance. It is recommended once you come into Ukraine, and you need to have your COVID test or passport of vaccination being together with you and presented on the customs. Another question, should I stop the stimulation in case I have a positive COVID test? This is a great question. Thank you for asking this. I would answer that during the process, once we restarted our IVF treatment, and also in Ukraine, our IVF centers were closed for about 1.5 months last year, between March and May. So after we started our IVF treatment, we have a protocol what to do and how to continue IVF treatment, even for those patients who got COVID test positive. And depends on how you feel yourself during your COVID being positive, and also depending in what stage you are in your stimulation, we make a clinical decision, should we continue your treatment or not. I would say that for 90% of the cases, just for safety of the process of the patient and all medical staff involved, we would stop the stimulation. However, in case we are in the process of stimulation, after we started, for example, agonist injection, and we have already enlarged ovaries with the growing follicles, and we need just to complete the OPU procedure within few days. So in this case, we would continue a stimulation and make everything in case to perform the OPU procedure safety for all involved. Another question is, can you tell more about the window of implantation, how this works? So it is confirmed by scientific experience and also by many clinical cases that every woman has a certain time when her endometrium is getting ready for the implanting an embryo. And as according to the protocols, we in IVF cycles, we always do an embryo transfer on day 6, and it is synchronized with the quality of our embryos. So we transfer day 5 blastocyst into day 6 endometrium, and we control day 6 by giving supplements of progesterone, starting either from the day of the OPU or from the day when we confirm that the endometrium is ready, according to the structure and the thickness. So for 11 to 15% of all patients all over the globe, window of implantation is moved, meaning that, and it is valid for about 24 hours. And embryo, in case we are transferring embryo in a specific day, it can be alive inside of our uterus also up to 48 hours. So there is a group of the patient between 6 to 7% for whom endometrium will be not ready on a day when we are going to transfer with this embryo, or will be already too mature to implant this embryo. And we are checking the uterus and the structure of the endometrium by seeing the pinopodis. This is a special tissue growing inside of the endometrium, and by checking this specific timing, we are selecting the best timing for the embryo implantation. Checking if we have more questions right now. This is all for now from our questions. I'm here with you a few more minutes, so if you still have any questions, you can ask. Always, I also remember very frequently asked question of how long should I stay in Ukraine once I am coming for IVF treatment. So I would say that we are trying to minimize the timing you will be here with us as much as possible. So we do a lot of online consultation. We are receiving all your medical records. We are checking them. We are discussing with you your treatment plan. We have our friends and colleagues almost in every country, in many cities, in many clinical locations, to where we can refer you in case you are located in your home country. And we will coordinate your treatment together with your local doctor or doctor to whom we will refer you for the consultation and treatment planning and also supervision before you will come into Ukraine. So this will be as maximum convenient as possible. And you will come only for the so-called critical procedures like oocyte collection, embryo transfer, sperm production, etc. Only for this you will come to Ukraine, and all the other timing you will stay in your home country under our communication, with our communication and under our monitoring. So thank you so much. It looks like these are all questions for today, and I am so thankful for joining us tonight. I will be happy to get in contact with you again for specific treatment options which we are offering together with International Fertility Group for surrogacy treatment, for oocyte donation, for unique services which we are performing as alternative to oocyte donation. And we will do everything possible to maximize and optimize your outcomes and make your dream of becoming parents possible as soon as it is possible. Thank you so much. Take care and stay in touch. Bye-bye.